Hello students, I am Dr. Mathew Jacob, Associate Professor from the Department of Oral Pathology and Oral Microbiology from Vinayagar Mission Shankaracharya Dental College. So today we will be talking upon the eruption of teeth. So what is eruption of teeth? Also known as tooth eruption, is a process by which teeth emerge from their developmental position within the jaw bones into the oral cavity. What we have to understand is they reach up to the occlusion or the functional position, which I shall be explaining in the subsequent slides. So what is the purpose of knowing this tooth eruption? So by understanding the sequence and timing of tooth eruption, we will be able to better diagnose the dental anomalies and also plan orthodontic treatment. What are the various factors which affect eruption? We have factors which include genetic, environmental, systemic and local factors. What is the clinical importance of knowing the eruption patterns? It basically helps us in orthodontic planning, in managing space, particularly when the deciduous tooth erupt or exfoliate earlier than usual. So therefore, the permanent teeth may erupt into occlusion earlier, thereby causing a disruption in the space. It also helps in the early diagnosis of abnormalities, dental abnormalities. Also, it helps in the preventive and interceptive care, particularly in the specialty of pediatrics and orthodontics. We now move on to an important aspect of the eruption of teeth. We have the phases of tooth development. We have three main phases. We have one which is the pre-eruptive phase, which occurs before the emergence or erupting of the tooth. Second, we have the eruptive phase, that is the emergence of the tooth into occlusion. And the last is the post-eruptive phase, which occurs after the tooth eruption, as minor adjustments which occur within the jaw. So what are the pre-eruptive phase? That is, it occurs before eruptions. So what we have to understand here is the developing tooth germ is intraosseous within the jaw, as you can see in the picture here. That is both for deciduous and permanent teeth. So what does this do? It provides space for the developing tooth germs. What do you mean by space? That is to accommodate the developing tooth germ, that is the subsequent teeth. Thereby there has to be space enough within the jaw as the jaw grows in three dimensions. We have the lengthening, the height, as well as the width. So these three dimensions occur in the pre-eruptive phases. So we have to understand here that the tooth germ, the rate of deposition or the rate of eruption is 1 to 10 micrometer per day. So therefore the bone remodels in three dimensions, as I mentioned before. This is basically for the lengthening of the jaw, for the deciduous molars, and then height, which is done by the root formation for the tooth of the tooth germs, and width, which provides us a space for the successional and permanent tooth germs. So this is an example or a photograph where we can see a mandible of a 6-month-old child. We can see here there is a trace backwards or move backwards. We can see that the tooth is occurring inside the tooth germ. Some of them the root is almost forming, and the others there are no roots, and the last permanent first molar we can see only the cusp is partially formed. So this is what, and the space which is occupied by these developing tooth is called as the tooth germ. This is a histological section of a mandible in a 7-year-old child. So we can see here the deciduous tooth which is present here and the permanent tooth which will be erupting occlusally. So all this occurs within the jaw. Next we move on to the eruptive phase of tooth movement. So what happens here? The tooth moves into occlusion. We have an axial or occlusal movement of the tooth. So as I mentioned before, from the developmental position to the functional position. What do you mean by functional position? The occlusal plane, the incisal surfaces of the tooth meet. What is the rate of tooth movement? It is around 75 new microns per day. And in this eruptive tooth movement, we have certain muscles which help to guide the tooth, thereby preventing either the buccal or the lingual tilting of the tooth. This is done by the muscles which are present in the tongue, in the cheeks and the lips. We have also certain habits such as thumb sucking, which enable the tooth to be move into occlusion, thereby a physiological function is maintained. One of the most important aspects of eruption of tooth are there are certain theories which are being given for how the tooth erupts. There are 5 basic theories. Among these 5 basic theories, the most important is the 4th one, and the most widely accepted one is the 4th one, is the periodontal ligament traction theory. I shall be showing a picture of demonstrating how it occurs within the jaw, and then I shall give the notes following this. So here we can see the presence of the tooth germ, which is within the jaw. The crown has formed, the root has not formed yet. So according to the first theory, we have the root formation theory. According to this theory, as the root forms or develops, the tooth moves into eruption or occlusal plane. The second theory, the tooth germ is within the jaw, and we have the osteoclast which will resorb the occlusal aspect of the jaw, and there will be deposition in the periapical formative area here. So we have the deposition occurring here. Therefore the tooth is pushed or erupting into the occlusion. The next theory is the dental follicle theory. According to this theory, we have the dental follicle which surrounds the tooth germ. So here what happens, there are cells which contribute, that is the osteoblast, the fibroblast, the osteoclast. Therefore all these cells along with the periodontal ligament fiber cells, that is, causes the tooth germ to erupt. The most accepted theory is the periodontal ligament traction theory. According to this theory, we have the periodontal ligament fibers, which are actually collagen fibers from the fibroblast, which cause a traction or contraction of these fibers, which generate force to push the tooth into occlusion. The last theory is the blood vasculature theory. Here we have blood vessels which are present here, which give the hydrostatic force which pushes the tooth into occlusion. So these are the basic theories of tooth eruption. We shall go in detail. Now, when asked in the exam, what we must understand, we must explain all the theories. This is a potential essay question. So we have to explain all the theories, and then we have to say what are the drawbacks, or what are the reasons that it is not accepted. So in the root formation theory, as I said, the key words are root elongation generates a force. Therefore, the pushing the tooth towards the oral cavity. But this theory couldn't explain the fact that certain rootless teeth can erupt. So what is the reason for that? What is the source for the pressure is not explained in this theory. The next is a bone remodeling theory. As I mentioned before, there is osteoblastic, which causes the deposition of bone in the proposed periapical area, and we have the occlusal aspect where resorption occurs. So in this area, there is selective bone resorption, but however this theory cannot explain what is the source or the reason for the force behind this tooth to be pushed into occlusion. The next theory is the dental follicle theory. According to dental follicle theory, there are certain signaling factors, molecules and cells which cause the resorption and formation of the tooth. Again, this theory does not provide evidence for the force which is needed or generated to push the tooth into occlusion. The most accepted theory is the periodontal ligament traction theory. According to this theory, there are fibroblasts in the periodontal ligament that exert tractional force. What do you mean by tractional force? There is contraction of the periodontal ligament fibers, thereby providing sufficient force whereby tooth is pushed into occlusion. The last one is the blood pressure vascular theory. So here we see that there is eruptive changes of the vascular pressure, or to better put, would be the hydrostatic pressure inside the blood vessel. Now, one of the reasons why this theory is not accepted is the hydrostatic force pressure does not provide sufficient or inefficient or insufficient pressure for the tooth erupt into occlusion. Next, we have an important 2-mark viva or short answer question. What is the gubernacular canal? So as I mentioned, the tooth has to move into occlusion. So the tooth has to pierce through the bone. We have then the oral epithelium, as you can see here, the oral epithelium that is present, and we have the bone which is actually continuous here. So in case of a permanent tooth, what happens is there is a channel or a pathway enabling the tooth to move through the connective tissue, that is the hard connective tissue, the bone, and reaching up to the oral mucosal membrane. Once it reaches here, there is a fusion of the reduced enamel epithelium of the tooth germ and the oral mucosa, therefore the tooth is erupted. So this provides a channel or a pathway for the tooth germ to move into occlusion. This is a picture just to show you the presence of gubernacular canal. So here there is no soft tissue, so we can clearly appreciate the gubernacular canals. Next we move on to the third and final phase, what is the called as the post-eruptive phase. So here simply put, it is just the adjustment of the tooth after eruption. This is basically to accommodate the growing jaws. It occurs up to the last tooth which erupts, which is the third molars. So roughly around 20 years. So this enables a proper socket position, so ranging from 14 to 18 years. It also helps to compensate for the occlusal wear. This occurs because of continuous cementum deposition. There is another factor, that is it accommodates for the interproximal wear which occurs in the crowns of the tooth. And there are two terms, that is active eruption and passive eruption. So usually this is a question they ask, is the difference between active and passive eruption. Eruption refers to the movement of the tooth towards occlusal plane, while passive eruption is the exposure of the tooth due to gingival recession, which is pathological. So this is just a slide to show how the tooth socket changes within the jaw and due to wear and tear. Another important question or another important aspect of tooth eruption is the sequence of eruption. So in this slide I have shown for the deciduous tooth. We have to understand here, both for maxillary and mandible, it is in months. And the first tooth to erupt is the central incisor, followed by lateral, then the first molars. So what we see is that the canine erupt after the first molars, then followed by the second. While in permanent tooth, it is the first molars and that erupt, followed by the central lateral, then the canine, and then the first molars. Now this slide shows the important questions that can be asked in the eruption of tooth. As I mentioned before, theories of eruption is an important question. That is the fourth bullet point. Specifically, they can ask periodontal ligament theory and the dental follicle theory. The reason for the dental follicle theory is that it is not accepted. It gives the reason for which is that they have certain cases where they have surgically removed the dental follicle, the tooth was not able to erupt. So that is one of the reasons dental follicle theory was not accepted, and is the reason they asked this as an important question. Next, again, generally, what are the phases of tooth eruption? What is the difference between active and passive eruption? Then other questions which are not directly related to this chapter, but however is included here, that is impacted teeth, ankylosis, premature delayed eruption. Another important question is the gubernacular canal, and of course this forms in the tooth morphology chapter, what are the teeth which have no deciduous pre. The textbook which I would prefer you to use is Auburn's Oral Histology and Embryology. If not, other foreign textbooks which are available, which I mentioned as the next. Thank you for watching the presentation. I hope I have covered important aspects of this chapter, and this will be beneficial for you for your university exams.